Hi guys, welcome back again to my YouTube channel. My name is Naomi Njoroge. I'm a registered dietitian. Today we have a very good topic that we want to discuss with you guys. It's all about peptic ulcer disease. We're going to discuss about peptic ulcer disease and the right diet you can consume when you have ulcers. But I want us to have an engaging talk, so I want him to introduce himself so that we can start the talk.
Hi guys, my name is Ben. Welcome.
So we are going to start with what is peptic ulcer disease.
Yes,
Peptic ulcer disease is when you have soreness in the lining of the stomach or when you have inflammation in the lining of the stomach. It can either be on the upper part of the small intestine or when it's on the lining of the stomach. That one can be caused by a bacteria called H. pylori bacteria. That bacteria is the one that causes inflammation of the stomach. When you have that one, then it results to ulcers.
Do we have types of PUD?
Yes, we have three types. We have gastric ulcers, that is ulcers that occurs in the stomach.
Okay.
Number two, we have esophageal ulcers. That one occurs on the esophagus, on the other part of the esophagus. Then we have number three.
The upper part only. The entire esophagus.
Yes, it depends. It can either, as long as it's in the part of the esophagus, it doesn't matter which part of it. And then we have duodenal ulcers. It occurs on the upper part of the duodenum. Yes.
So what are some of the symptoms of the PUD?
Signs and symptoms, we have like nausea. You can feel nauseated. Sometimes you vomit. Sometimes you have blood in stool. That one can show you that sometimes you have internal bleeding. So when you see blood in the stools, that shows that there's some blood coming from the inside. That one is also a sign of having ulcers. Sometimes they also change in appetite. You feel sometimes you don't want to eat, sometimes you want to eat. There is variation in that change of appetite. So you have vomiting, you can have nausea, you have a change in appetite, you can have blood in stool. That ones are the signs and symptoms of...
Do you need to have all of them or just one of it?
It depends. You can even have three of them. Another person can have two of them. It depends. There are some tests that can be done. It's called endoscopy, where the tube is done with the camera down there. Then they get to see what is happening in the lining of the stomach. The endoscopy is a test that is done when you're testing for the ulcers, for the peptic ulcer disease.
Okay.
Yes.
And which age limit does it affect?
It doesn't matter. I think it can affect anyone, even adults, even children also have gastritis, because I've experienced a child who has gastritis at a very maybe even 15 years or either maybe even 10 years. I don't think it has an age limit, but sometimes it mainly gets to adults because of the bacteria.
Do you have certain foods which cause this PUD?
Yeah, there are certain foods, unless we say foods to take and the foods to avoid. For the foods to take, we have, let's start with the fruits. You can take watermelon for the fruits, because it's not citric.
So all citric
fruits should be avoided. Okay. Things like pineapple, oranges, passion fruit, those citrus fruits should be avoided because...
Are you trying to say people should stop eating pineapples or...
No.
They should take it in low limits?
For those who have peptic ulcer disease, they should avoid taking oranges, pineapples, and passion fruit because they are citric. When it's citrus, and then you see you have sores in the lining of the stomach, and then your inflammation, see, obviously that one irritates because of the acidic level you get. So you need to take fruits that are less acidic. Like we have the watermelon, we have the apples, you can take avocado. Those are the fruits that...
Avocado,
yes. Those are the fruits that do not have too much citric acid in them, so they cannot actually irritate the lining of the stomach. When you go to proteins, you can take eggs, but avoid deep fried eggs. Take boiled eggs. And then you can take, there are two types of proteins in terms of meat. You have the white meat and the red meat. For white meat, you can take any amount, but avoid the deep fried meat, white meat. For red meat, you take very minimal pieces. Like we always tell them to take 3 to 4 pieces.
Just 4.
3 to 4 pieces, yes. Once or twice per week, and it's not even a must. That one I'm actually giving you a small moderation. It's not a must to take the red meat.
Okay, and vegetables?
For vegetables, you're supposed to avoid the sukuma wiki. You can take spinach.
Okay.
Avoid sukuma wiki. Avoid the mboga za kienyeji.
Avoid, why should you avoid them?
Because
they are even better.
They're kind of citric. You know, for ulcers, we are avoiding anything that is irritating the stomach. You see, like even maziwa mala, you're not supposed to take maziwa mala for those who have ulcers because of the fermentation.
Alright.
The carbonated drinks like soda, Lucozade, Ribena, Del Monte, all those have they are carbonated, so they have gas in them. That one will actually irritate the stomach. Also things like kachumbari. Don't take kachumbari because raw tomatoes are actually citric than when cooked. You prefer cooking than taking the kachumbari itself.
Okay.
Avoid taking nyama choma also.
You should take boiled nyama.
Yes, you take boiled nyama, but now you can kaanga. You can use maybe cooked kitungu, cooked tomatoes instead of using the raw tomatoes. The other thing, you avoid yogurt. Yogurt, you know, it's also fermented. It's like fermented milk with flavors. Anything that is fermented, anything that is citric should actually be avoided.
Does stress affect in any way?
Yes, stress. Because when you're stressed, there's some hormones that can rise up. When you're stressed, actually stress is one of the factors that can cause ulcers. They always say it's either stress or maybe the way of dieting. Because actually when you go to a medical facility, the first thing they'll ask you, are you stressed? Or how is your dieting?
How do you guys treat stress?
Stress is all about, it's a personal issue. So all you need is, you can see a psychologist.
As a doctor?
As a doctor. You can see maybe a psychologist who can help you in that process of maybe managing your stress. They take you on various steps on how you can manage your stress. And also maybe a nutritionist to guide you on the right diet to take. Because when you eat the right diet, when you have ulcers, chances of having low cases of your ulcers don't affect you too much is high. When you eat right, that is. Okay. The ulcers won't be severe. And then the other thing is for red beans. Avoid taking red beans. Take yellow beans. Red beans are more...
Examples of those red beans?
Red beans are the normal red beans. The normal red beans. The red beans you know. Yes. Yes, those are the red beans. Yellow beans is the yellow. Okay. Yes. You soak them. You soak them like for 48 hours. And then they can be ready for cooking. Yes. And also the other thing, there are measures to take when you have ulcers. You drink plenty of water frequently. Like you can take 8 glasses of water per day. Okay. And then the other one, after you take a meal, you rest 30 to 45 minutes after food consumption, yes. Because when you take a meal and then you're going on and you're very active, sometimes that food tends to, sometimes you tend to have heartburn. So that's why for ulcers, people always tell them rest 30 to 45 minutes after food consumption to avoid maybe those issues of heartburn. Yes. And then when you're lying on your bed, for ulcers patients, they shouldn't lie flat. They should maybe use a pillow because sometimes that heartburn comes up, especially after a meal. So always tell them to use a pillow to hold their back. So even when you have a disruption of the heartburn, somehow the food tends to go down than going up. Do you get the point?
I see.
Yeah, they should lie not flat, but you say elevated bed.
Okay.
Yes, you can use maybe a pillow.
Pillow, maybe a mattress.
Or maybe a mattress, that you make sure your head is kind of lifted up. Don't just lie flat. Okay. Yeah. I think that's the whole thing. I've talked about the different types. We mentioned 3. We talked about the causes. They're actually causes of peptic ulcer disease.
What are they?
We have the bacteria itself. It's called H. pylori bacteria. That one causes actually inflammation in the lining of the stomach. Number 2, we have using of inflammatory drugs. We have, for example, you see aspirin. Yes, the NSAIDs. Those ones are the inflammatory drugs.
They should be avoided.
That one, not they should be avoided, but they are causes of having those ulcers because they cause inflammation of the lining of the stomach.
What are the chances? If you see, maybe a doctor
may recommend you, yes.
This medicine. So will you get this disease?
Actually, you won't get it, but when you use it for a long time.
Oh, okay.
Yes, when you use it for a long time, the NSAIDs, the aspirin, those NSAIDs, they are called the inflammatory drugs. That one can cause actually the inflammation of the lining of the stomach. Then you have those people who smoke. Smoking is also one of the causes. Smoking of cigarettes, especially cigarettes, that one results to increased levels of, we say bile salts, that causes reflux rate. So when you smoke, it results to increasement of bile salt reflux rate.
And smoking shisha?
Even shisha. I think anything involving smoking causes irritation and causes the increasement of the bile salt reflux rate, causes the inflammation of the lining of the stomach. Do you get that point?
I'm getting it.
The other cause, we have stomach cancer. Stomach cancer can also result to peptic ulcer disease, and we have radiation therapy. You see those rays can somehow result to inflammation of the lining of the stomach. That one can also result to ulcers. So we have 5 causes, 5 main causes. That's H. pylori bacteria. We have smoking. We have using of inflammatory drugs like aspirin. We also have not smoking but stomach cancer. And you also have when you have radiation therapy, because it can result to inflammation of the lining of the stomach. So I think that's the whole issue about the peptic ulcer disease. Anyone who has a question, you can comment down below. You ask any question concerning peptic ulcer disease. You can get to tell us what you want us to discuss more about the disease. If you haven't understood anything, we can always make videos on more on that. And then make sure you share, you like, you comment, you subscribe. And then till we meet again in the next episode.